Hello and welcome to another episode of your show, Medical Talk. I'm Dr. Mohammed Al-Mahtab. And today our topic is about acute kidney injury, also known as AKI, and chronic kidney disease, also known as CKD. Acute kidney injury and chronic kidney disease are two distinct yet interrelated conditions that affect the vital organs responsible for maintaining the body's internal balance. AKI is a sudden and often reversible decline in kidney function, usually resulting from an abrupt injury or illness. It can have various causes, from severe infection to medication side effects. But on the other hand, the CKD is a progressive long-term condition characterized by the gradual loss of kidney function over months or years. Now, both AKI and CKD demand close medical attention, as they can lead to serious health complications. So, if you want to know more about our topic today, please stay with us and we'll give you more information. Welcome back. We're happy to have with us in the studio Dr. Amr Al-Attar, a consultant internal medicine and nephrology, clinical director of nephrology department. Welcome to Medical Talk, Doctor.
Thank you, Dr. Mohammed, and thank you for having me in your show.
Thank you so much. I want to just get first the clarification. What's the key difference between acute kidney injury and the chronic kidney disease, and why is it important to distinguish between the two?
That's a very good question. Acute kidney injury is a sudden, abrupt decline of kidney functions. Chronic kidney disease is a chronic, slow, progressive decline in kidney function. Acute kidney injury occurs in a matter of hours to days. Chronic kidney disease, we need to define or to diagnose chronic kidney disease, it has to be at least present for 3 months. So the course and the duration are the main differences. The other thing is that acute kidney injury is usually reversible condition. That's why we call it now injury. We used to call it failure before. Now we call it injury because it is, in more than 99% of cases, it's a reversible condition. While chronic kidney disease is not a reversible condition. The damage is already there, and all what we can do is to halt or slow it down. But we cannot regain the kidney function back to normal.
I see, I understand. So, but what are the common causes and risk factors to the acute kidney injury?
The acute kidney injury, usually it happens in a critically ill patient who has been in the hospital for medical reasons, especially in the ICU. Majority of our patients are usually in ICU patients. We used to classify the causes of acute kidney injury into causes that happen before the kidney or pre-renal, causes that happen in the kidney or renal, and causes that happen after the kidney or post-renal. The causes before the kidney, like any cause that causes drop in the patient's blood pressure. Severe blood loss, severe dehydration, severe loss of body fluids like in burn, all this heart failure or myocardial infarction causing low cardiac output, weak heart muscle that causes low blood pressure, any infection, bacteria that reaches the bloodstream and causes sepsis and drop in the blood pressure. All this will lead to decreased blood supply to the kidney, leads to injury, acute injury to the kidney. The renal causes, most common we see is drug-induced causes, like some antibiotics, some medicine that we give for treatment of cancer, chemotherapies, some the famous non-steroidal anti-inflammatory or the pain medication that we usually get over the counter, unfortunately, in all of our pharmacies. Contrast materials we used in some radiological investigation. Some immune diseases that affect the filtering unit of the kidney, like in lupus, systemic lupus, and in vasculitis. Some affection occurs in the kidney, sometimes secondary to infection that happen acutely in the kidney. So all these are the major or the famous causes for acute kidney injury from within the kidney. The post-kidney is anything that causes obstruction to the urine outflow from the kidney. When you have a stone, when we have a tumor compressing the urine output, bladder tumors, prostate, all this, but there is a difference. It has to happen on the level of both kidneys. The obstruction should obstruct the urine from both kidneys.
So it's bilateral, basically.
Bilateral. So bilateral stones or a big tumor compressing the urine flow from both sides, or in the urinary bladder, the final urine outflow. So these are the post-renal causes, or the major or most important post-renal causes for acute kidney injury.
I understand. So that was regard with acute kidney injury, which is reversible, you mentioned.
Yes, usually with treatment of the cause, the kidneys have a remarkable ability to regain its function. Yes.
So, doctor, what are the stages of the chronic kidney disease, and how does it progress, basically?
We classify the chronic kidney disease according to a parameter called the glomerular filtration rate. This is the rate by which the kidney cleans the blood per minute. Normally, the kidney can clean between 100 and 120 milliliter of blood per minute. So this is the normal glomerular filtration rate, or GFR. We say that stage 1 is a GFR between 90 ml to 120 ml. This is we consider as normal. Between 60 and 90, we call this stage 2 chronic kidney disease. From 30 to 60, we call it stage 3 chronic kidney disease. From 15 to 30, we call this stage 4 chronic kidney disease. Below 15 ml per minute, we call this stage 5, or the end stage kidney disease, which is usually the dialysis or where we need to start a renal replacement therapy.
So that basically indicates the efficiency of the filtration.
Yes.
Okay. So that's basically the staging.
Of course.
Okay.
This is the main classification by most of the international nephrology societies, how to classify the chronic kidney disease.
But is there like a time span between like stage 1 and stage 2, usually, like how the patient will go from stage 1 to stage 2, or does it depend on the health condition of the patient and the care they receive?
Yes, usually this depends on a lot of factors. Depends on the patient age, depends on the patient's comorbid states, what other medical condition he has, depending the patient compliance to our instructions regarding compliance to medication, compliance to diet, compliance in avoiding taking unnecessary medication that could harm his kidney. Other factors like he might unfortunately get any of the reasons we mentioned before for acute kidney injury that could lead to temporary deterioration in the kidney function, and then we can regain it back to the baseline. So it differs from patient to patient according to all these parameters.
Interesting. Now, I want to go back to the acute kidney injury because it's very important. What are the early signs that a patient or a person can experience to know that they might be actually a candidate or facing acute kidney injury, or may they be suffering from acute kidney injury?
In contrast to the common beliefs among most of our patients that the kidney is only a filtering organ.
Yes.
Actually, it's not. Filtration is only one function of the kidney. The kidney has several functions in our body, and disturbance or decline in kidney function can have a lot of manifestations. For example, decrease in the urine output, swelling in the body, unexplained increase in the blood pressure or deterioration of a previously controlled high blood pressure. Gastrointestinal manifestations like unexplainable nausea, loss of appetite, vomiting. Sometimes you can get alteration in your mental status, lack of concentration, loss of energy, up to complete loss of consciousness and coma in very advanced stage. The kidney is important for the integrity of our bones. So one of the manifestations of kidney decline is bony pains, but this is more common with the chronic kidney disease rather than the acute. Unexplainable fractures after minor trauma in unusual sites. These are pruritus or itching, unexplainable itching. All these are the most common manifestations of decline in kidney function.
I understand. So, in your opinion, what are these steps that an individual can take to basically avoid or reduce the risk of having acute kidney injury or, eventually having chronic kidney disease?
Well, let's start by the basic things. Lifestyle. Adopting healthy lifestyle. Avoid the intake of any unnatural things in food or in drinks. Regular exercise. Avoid excessive weight gain. Avoid intake of any medication without doctor's prescription. And I have to focus because this is one of the most important causes of acute kidney injury are the anti-inflammatory medications and some antibiotics. The patient will have back pain, for example, for 1 year, 2 years. He's just consuming pain medication, painkillers. It affects his kidney and he doesn't know. And one of the problems of kidney disease that usually the manifestations of chronic manifestations of kidney disease do not usually appear or become symptomatized except when we are in stage 3, like below 45 ml to 30 ml per minute. So this is a very late stage already. Yeah. So the damage happened, you cannot do anything. So we need to avoid the unnecessary intake of any medication without doctor's prescription, especially in patients who have already risk factors like our old population, patients who have long-standing blood sugar high, diabetes, long-standing high blood pressure, long-standing heart failure, patient with chronic malignancy. Any patient with chronic morbid states usually are higher risk of getting acute kidney injury rather than the healthy individuals. So these are the main instructions, my main advices to our patient. Also regarding the diet, I want to specify on the excessive intake of proteins. Some patients, especially the younger population, they want to look healthy, they go to the gym, they consume a lot of protein supplements, unfortunately without medical supervision, to build the muscle mass, to look healthy, and they don't know whether their kidneys can tolerate this or not.
Exactly, it's too much.
And they come after that with kidney problem. So if you want to do that, you have to do it under medical supervision. You need to consult your doctor first. You need to check that your kidneys are in healthy condition. And you need to use the natural sources of protein rather than the supplements. And nevertheless, of course, I don't want to mention about the steroids intake and the hormone intake, which will damage not only the kidney but a lot of other organs also.
Absolutely. And we still have more to talk about, but we have to take a short break. Please stay with us. Don't go anywhere. Welcome back. We're still talking in the studio to د.عمرو العطار. د.عمرو, before the break, we were talking about the irreversible kidney injury and the chronic kidney disease, basically. Now we want to focus on the new developments and the treatments in this field regarding for the kidney injury, acute kidney injury, and the chronic kidney diseases. So can you shed the light on those two issues?
Yes, actually now we have a lot of new medicines are already in the market, and others are maybe in the final stages of medical research that will help us to treat a lot of causes of acute and chronic kidney diseases. We have medicines for the immune-related kidney problems like a lot of monoclonal antibodies that helps with the autoimmune kidney diseases. We have medicine for the diabetic kidney disease that delays the progression or the development of diabetic kidney disease. We have also medicine in cases the patient reaches already dialysis stage and he did a transplant. We have a new transplant medications that improves the 5-year survival of the kidney graft to more than 90%. We have improvement also in the dialysis technology. And we are now approaching the phase of a portable, implantable dialysis machine, still maybe expected within the coming few years. Also in the field of transplantation, we are in the research also for other sources for organ other than the humans, like the animals, like from pigs and from monkeys, which are very close genetically to human beings. So all these are ongoing, and I hope in the very near future we will have a lot of medicines that will help us in this field.
So the future is bright, basically.
I'm always optimistic.
Okay, so now obviously it's very important to be vigilant and keep on regular screening for the kidney function, especially for those who are high risk. So what's your thought on that?
This depends on what risk factors you have. So for example, if you have a family history of kidney problems, but you are young and you don't have any other medical problems, so I will advise to check your kidneys on annual basis or every year. But if you are a patient with high blood sugar or high blood pressure for a long time, I always advise my patients to do the checkup like every 6 months. They should check their kidney functions. They should check for their urine for protein, which is one of the earliest signs of diabetic kidney disease. They should check their cholesterol level every 6 months. They should do a retinal examination or eye examination at least once yearly, because in the eye we can see the blood vessels which are identical to the kidney. So when we examine the retina or the eye and we can see that there are diabetic or hypertensive changes, we expect the same in the kidneys. So this is my recommendation for patients with hypertension or high blood pressure and high blood sugar, is to do this checkup every 6 months.
Exactly. So it's very important, I think, to also highlight to our viewers that it's not just the kidneys. It's actually other organs that might be actually showing early signs of kidney problems, because usually, as you mentioned, kidney problems in general, whether it's acute kidney injury or a chronic kidney disease, could be discovered late, but there might be an early signs that we need to be vigilant of.
Yes, of course. You have to monitor always for the volume of urine. If you notice that your urine is excessively higher than normal or lower than normal, could be a sign of kidney disease. If you notice abnormal swelling in your legs, in your face, in your hands, this could be a sign of kidney disease. If you notice any abnormal breathing pattern, shortening of breath, this could be a sign of kidney disease. So yes, and all this, you should immediately seek medical advice. Your doctor can help you and can guide you in the right way, whether this is a kidney problem or non-kidney problem. This all beside the routine checkup for blood sugar, not only for kidney function, we check for the blood sugar control, we check for the cholesterol level, we check for the liver function, we check for the urine. So it's usually for the diabetic hypertensive patient, it's a full checkup.
Exactly. So now, I know we talked about the diet and the lifestyle change. I want to just focus on one issue right now, because it's very important, I think, especially in a country like Kuwait or in the Gulf region, which is high temperature. It's very, very important that we consume enough amount of water, basically, keep hydrated, because this is, I think, is one of the main issues that we are facing. That a lot of people.
This is number one advice for me, for all my patients. You need to consume at least 2 liters of fluids every day, or 8 cups of fluid every day. And I will not say only water. Some patients get fed up of water. I told them juice is water, soup is water. Even coffee and tea and milk, they contain water. So you can have the water from a diverse sources. Just drink something every 3 or 4 hours. You can drink 1 cup of anything: water, juice, soup, coffee, tea. I don't mind, but for coffee and tea, we don't need to be very much excessive.
Exactly.
I know we love coffee and tea, but once or twice daily is enough, and should be away from the food.
And before we wrap up here, I want to ask you about, we touched a little bit on diabetes and hypertension, and those are the 2 leading chronic diseases that we are having here in the region. A lot of people, they might not lose focus on their renal health, basically kidney function, and focus more on dealing with diabetes and hypertension. But a lot of people, they're not aware that there is actually a precipitation that could happen because of diabetes and hypertension, if they're not being tackled and treated well, that could actually lead to kidney problems. Could you highlight the linkage between the 2?
Well, diabetes and hypertension are the second cause of chronic kidney disease and renal failure all over the world. The first, they can represent about 24%. The number 1 cause is the autoimmune kidney problems, about 34%. Diabetes and hypertension comes in second place. Our professors used to teach us, if a diabetic patient is destined to live forever, he will definitely at some stage of his life get a diabetic kidney disease. So you need to be very vigilant when it comes to your kidney function when you have diabetes. Control of diabetes and control of blood pressure will protect not only your kidneys, will protect your heart, will protect your blood supply in the different organs. So my advice is, if diabetes is controlled, he will become your friend. If you neglect and diabetes becomes uncontrolled, he will become your enemy, and it is a merciless enemy.
Yeah.
He will attack every organ in your body. So be friendly with your diabetes, follow your doctor's instruction, be compliant with the medications, be compliant with the diet, and you can live as normal
life as possible.
Dr. Amr Al-Attar, thank you so much for sharing all this valuable information with us, and hopefully we'll be able to have you with us in the future. Thank you for your time.
Thank you, Dr. Muhammad. It was very nice interview, and I hope the information we spoke about today are useful to our viewers.
I'm sure
Thank you very much.
I'm sure it was. Well, dear viewers, we still have more to show you, but we have to take a short break. Stay with us.
Dialysis is a procedure to remove the waste products and toxins and excess fluid from the blood when the kidney is not working properly. There is 3 types of dialysis, which include intermittent hemodialysis, peritoneal dialysis, CRRT, or continuous renal replacement therapy. The dialysis have many approaches: intermittent hemodialysis, peritoneal dialysis, continuous renal replacement therapy. These approaches, the choice of these approaches depend on the patient condition, availability, and the cost of the procedure itself. First of all, we'll talk about the intermittent hemodialysis, where the blood is circulated or filtered through special lines and filters with a specialized machine acting as artificial kidney. And these sessions of hemodialysis from 2 to 3 sessions per week. Each session is around 4 hours. While the peritoneal dialysis, it is more advantageous than hemodialysis, but its choice depends on the patient conditions and certain factors related to the patient himself. For the peritoneal dialysis, there is a special sterile fluid filtered or run through a tube into the peritoneal cavity, where the absorption of the wastes and the toxins happen or done through a semi-permeable membrane, which is the peritoneal cavity. These procedures more advantageous than hemodialysis, as it's done at home, done by the patient with a special machine also. But the problem or the issue about the cost of the solutions and the machine for this procedure. When to start dialysis? This decision to be taken by the nephrologist. This is depend on certain factors. First of all, when the kidney stops to work efficiently and arriving around 10 to 15% of its efficiency. Second thing is the appearance of certain symptoms to the patient, which including nausea, vomiting, cramps, disturbed level of conscious, fluid retention, and generalized swelling of the body. Also depend on some labs for the renal function, electrolytes and minerals, and acidity of the blood. Next thing I want to discuss about this dialysis is transient or chronic. Transient, this is happen when in certain situation. Transient is an acute condition. Some patients suffering from drugs intoxications or some sepsis or infection. And this situation, we're doing 1 to 2 sessions for hemodialysis until the kidney resume its function. While the chronic, which it will be long life, all his life doing hemodialysis or peritoneal dialysis, because the kidney is no more working. It is an end-stage renal disease until the patient proceed to the renal transplantation. Sometimes some patient asking about any side effect or any problem with dialysis. When these all symptoms happen with the patient, at that time, we must start dialysis, because dialysis removes the toxin, waste products. After that, the patient feeling better and well. Appetite is better, breathing is okay, his power is okay. Even the patient can go in his life working, sports even, according to the age, of course. No side effects for the dialysis, except this is related to the patient condition. It depends on the patient himself, according to the age, according to the blood pressure, some medical or morbidities. If it is only his end-stage disease associated with any diabetes, hypertension, cardiac problem, some patients suffering from hypotension, muscle cramps, even some lose blood in the dialysis machine, but this is related to the patient itself. It is individual variation for every patient. My advice to any patient with a chronic disease like diabetes, hypertension, and cardiac problem have to monitor his renal function regularly, even from 1 year to 6 months, to check his renal function and checking everything with regard to blood pressure, blood sugar, and his cardiac condition.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, I'm Dr. Mohammed Al-Muhtab. Stay safe and stay healthy.